So, Rosa, I'm so glad to just engage with you today. I know how intimidating policy making, and you know too, because you're in this space of like being an entrepreneur in the front lines, showing nurses that they can do these really cool things. And through my nurses association, I have spent many, many years and talked and presented to probably over 1,000 nursing students to remind them as nurses, like there is a whole policy process that we need to engage with to give feedback to make sure that policies really serve our patients and our families. So I'm so glad to get with you today because I often see in that classroom just this intimidation factor. And once I have that presentation, because I do a live call and everything, then nurses are like, oh, that's super easy. So I have been on LinkedIn, and I really appreciate you engaging with me, but blasting because I think there's this immense opportunity for nurses to inform something happening with the Centers for Medicare and Medicaid. We have a new administration. They're going to do things differently, like every new administration is going to do. And this one is really starting to understand that, hey, our health information ecosystem, all these apps and software programs, the federal government is honestly asking, how are they doing? And I often feel like nurses are the end user for a lot of these programs, and they are often the ones where they're filling the gaps when the software company didn't do their due diligence to understand their job. And so I wanted to work with you today because I also know that you have this amazing, amazing perspective and heart for the stroke community, and just live show, like, because it is like, because I even want to hear from you. I'm going to tell you, I need you to comment on this RFI, and I need to hear like your first cut.
I did not.
What was your first reaction when you got my email?
I was like, I have to perform. I thought I was just interviewing.
Right, because what is it? We don't think we're good enough. I don't know what it is about nurses. They think they need to have all these titles behind their name. They think that they're not the one to be commenting on something like this. But this is literally why it's called submit a public comment. And I almost thought about, but I don't want to shame people that are making comments. Like if you would look at the public comments that are being made today, they're not eloquently laid out in some PhD format, right? It's the stories that these policymakers need, and nurses have a treasure trove of them. And nurses are the one really solving a lot of the problems that CMS is trying to figure out how to solve. And we're not there at the table, so things aren't going to get solved the way that we would solve them. So
we need to help them help us so that we don't have to do as many workarounds, hopefully, in the future.
That is the goal, right? So yeah, on LinkedIn, like we've been telling people, go look at primary record. Yeah, you can call politicians and there's bills and everything, but there's this other process called request for information. And this is done often around, and sometimes it's mandated really, when federal government agencies like CMS, the Centers for Medicare and Medicaid, when they need to go get changes or figure out a new way or come up with policies, they often put out what's called an RFI, which is a request for information. And it is intimidating when you open it up. There's a lot of legal jargon, and it feels like some of the words aren't phrased exactly that prompt nurses to know where to insert their information. I think that's one of the biggest hurdles. And so what I'm going to do is I'm just going to talk to you to pull out a few questions. And what we'll do is we'll make sure whenever we're blasting this is, because really to me, there are like 5 or 6 of these areas in this RFI that nurses really need to focus and just comment on. And it's relaying those stories that we see every day, that we are basically holding the two ends between the hospital systems and our families and trying to help bridge, making sure that family gets home safely and takes care of their loved one, right? Like at the end of the day, this is also what's causing the burnout of nurses when we're holding everything together and it just keeps failing our families and patients. Like I know I lived it, but
and then you stress out about like, well, if I'm not here, what's going to happen to these people?
Exactly. I know. If you're a nurse that's had this thought, then this is an RFI.
Go home and not worry about how the system is going to fail them when you're not there to hold the two disconnected ends together.
No, and I've heard that from nurses so many times where they feel like they're just doing a prayer and a hope that when the family gets home, everything goes okay. And I'm like, that is not how we should be discharging our patients back out into the community. And why is that happening? And I think so much of it, I think there is a lot of great work happening getting health data exchanged, but the one that we're really solving, especially at primary record, and why I want nurses' input, is there's just a big failure point for families when we put patients back out in the community. There's just so much out in the community that's not connected to that beautiful flowing of information. And I think this is where we could leverage families to really own it and work with the teams that they're defining. Okay, let me pull up.
So
Okay.
do you want me to share my screen to go to the regulations page, or where do you want to start?
For starting, I just want to have a conversation. Let's find the story that you know as a nurse or that you've heard in your stroke community, and let's get the story in our head. So this is what any nurse would be doing. Like, okay, yeah, I relate to this and I have a story. So then then we'll kind of walk through, then where do you go put that story and how do you comment? So some of those prompting questions, where do you feel like, and just tell me next if it's not like bringing up a story or something, but okay. What's a moment in stroke care that made you say this should not be this hard?
Well, the first thing that comes to mind is FMLA paperwork, but I don't know that that's a CMS problem.
No. I mean, yes. I mean, FMLA is a government process, right? And it might not be CMS's. Okay. Well, let's see how we do, because this is like live. Like, I don't know how to do this either. And so we're like, Rosa and I are putting ourselves out there to like figure this out. You're like, Jean, you're supposed to be the expert. Don't tell me you don't know how to do it.
Right. Experts YouTube things all the time.
I know. And nurses, what you can do to dump what you know or your story into like ChatGPT or Gemini and say, make this sound so I can make a public RFI comment. And you'll be like brilliantly impressed like on how that can help you if you feel like you need to be more eloquent or well-spoken. Okay, let's focus on what features are missing in today's digital health tools for patients or caregivers.
I want one FMLA form that works for freaking everybody, no matter who their employer is, that the attending physician in the hospital or primary care can sign, and they're not going to throw it back and forth like, I don't know how to fill this out. You've got your diagnosis. You were in the hospital these days. This person should not lose their job for being in the hospital, and their loved one who has to drive them home shouldn't lose their job over having to transport them to their appointments that are saving their life.
Okay, well, there you go right there.
Can we do that? Can we just
you can totally do that one. You're way more passionate about that one.
Well, it's so ridiculously unnecessary, complicated. Just have a standard form. Like you said, it's a federal government program. It shouldn't be different by employer. And maybe that's my naivete and not knowing how complicated things need to be. I don't believe it. I believe that it has to be simple, and it shouldn't be so complicated, and it should be streamlined. And
yeah, no, I think I felt so many times when I was trying to coordinate people's care that I felt like the system just wanted people to die. Because they're making it so hard.
And lose their jobs.
And lose their job and have these terrible circumstances. And yet we want people to be working so they can keep their Medicaid and all of this stuff. And it's like...
You want to have work mandates to receive services? Well, how about they don't lose their jobs for attending their doctor appointments? That would be
let's focus on that one. And you know what? I also don't know if FMLA is tied to CMS, but we're just going to share these stories and figure out, because like I don't want this to be
allocating things to different departments. They don't have to stay in the same department. Did you know emergency medical services is under the Department of Transportation? Well, that's ridiculous. That should move, and that should be under CMS maybe. Department of Health and Human Services.
Seriously. Federal government, just invite a bunch of nurses to the Washington and we'll solve all your problems in a day.
While we're reorganizing things, let's make it better, right? If we're going to break everything and put it back together, there's some things we could put back together better.
And this I think is where nurses get overwhelmed, because I'll claim too, like I have probably got every day someone's tagging me like, Jean, are you going to comment on this RFI? And I even admitted to a friend, I have a little bit of paralysis by analysis, because there's so much I feel like I could say, and you get to a point where then you're paralyzed and you don't speak up. So that's what I'm trying to, in our talk, is to just empower nurses to get out of their head, get out of their way, and just go comment. Like, and I'm almost doing this for my own pep talk, that after this call, like I will finally sit down and write my public comment on what we want to do. And I watched the webinar, and like, there's this gal named Amy Gleason, and she was like, dream big. Like, and that's what I want nurses to do. Like, all of nurses have amazing ideas, and they see the problems every day. And so if we can get nurses commenting on this, I really like deep down believe like we can really impact where the direction of this is going. Because my fear is a bunch of,
but also social workers and shameless.
Yes, no, sorry, I keep claiming on nurses, but yes,
you're right.
Yeah,
but
because
social workers are even more in a lot of cases intimately aware of the financial impacts and what the government systems are. Like, everything I know about it, I have learned from social workers.
Oh,
And
100%. The best is a nurse and a social worker, because we inform like the direction that health journey is going, and they tell us how we could get that financed, how we could get that set up, how we could figure out the right program. Because you're right, that is a bucket of knowledge nurses we do not have.
yeah, we don't learn that stuff in school. We're like, that's for social workers. So
I know.
they should also be encouraged to comment.
All right, so if you think you can share your screen, let's pull up
I'm gonna try that.
the first screen.
This is my first time sharing my screen in here. Just the Federal Register. Now, do you see that?
And it's intimidating as heck. So just do a dramatic effect of scrolling today, and then you're going to land here and you're going to be like, WTF, girls. Like, I have no idea where to begin. And so when we throw that, I'll make sure I focus on a few key questions. Like, if you want to geek out, go for it. Read this whole darn thing. Yeah, no, just to lay it out. So what the federal government did in here is it called out that there are certain people they want to hear from. They want to hear from patients and caregivers. They want to hear from providers. They want to hear from technology vendors. They want to hear from payers. Like, anybody that can inform them. They don't care who you are.
Good.
They want to hear what's
We're
working.
all stakeholders in this.
And what's not working. Exactly. And if you don't think you are, you will be. Because at some point you're going to have to use our healthcare system. I'm sorry. It's going to affect you one way or the other. Okay, so when you're on here, we'll link in like a little... I'll have to create like a little document when we go blast this out, Rosa, that people can click on and just focus on a few things. So let's say... You are inspired. You want to talk about this FMLA problem, I think, right, Rosa?
Sure.
And we said, because you said what inspired you is you heard the question, what features are missing in today's digital health tools for patient or caregivers? And you heard that, and your brain just went, psh. So that's what we're doing over on that primary record page is I'm giving these one questions because I hope things like that happen. You hear the question, and you're like, oh my God, here's the problem. And so when you have that moment, I want you then to click submit a public comment.
Are you seeing what happens on my screen? Is it moving?
I'm seeing it. I'm seeing it.
Okay.
And
so this is the room for the this part looks simple.
It does, but there's that blank box, and I don't know. And maybe it's because of my brain. Like, when I get a new document and I have to go write something, I then shut down. Like, I'll be real inspired and I have all these ideas, and then I open up a screen like this and I hit, like, what are you going to start typing? Like, or are you a person that can just start typing and talking?
I mean, talking is better for me, so I really liked your idea of, like, talking to ChatGPT or Gemini or something and say, look, here are all my ideas, and then help me sort it out. I actually wrote a book that way, just talking it, because my ideas do get disorganized, like our conversation. But that doesn't make those ideas invalid.
No, they need structure, and that's what the beauty of AI is. Yeah.
So here's a question. Are we allowed to comment more than once?
Yes.
Okay. So we can, or let's see, is there a word count? I didn't read. Is there
you know what? It's funny because I've been getting mentored by lots of people on this whole process. And someone told me there was a 5,000 character limit. And then I had a friend that actually works in government. And she said, no, there shouldn't be a character limit. But I guess when I asked ChatGPT that, it said, it just depends on the RFI. So here's what you do. If you're commenting and suddenly it's like red bars of stuff and you can't, if you go down, do you see how you can add a file? You can copy your comment into a Word document or a Google Drive and then just upload your file.
That's awesome.
So that's another way. So, and then you can just say in the comment box, see attached file.
Yeah. And then you could be anonymous. Like, your email address is not going to be posted, but
Correct.
You can
because they're just making sure you're a real person by having the email, I think is the whole reason for that. But you then select if you're an individual, if you're representing an organization, or you just don't want, if you want to be anonymous, that's fine too.
And there are alternative ways to comment?
Yeah, so this is definitely in an electronic way. So when you click on that, it describes things like how to mail in a comment, but then giving yourself plenty of time. I feel like there was like one other way, like maybe you can call potentially, but I don't know. I'm such a electronic person. So
okay, so these are due by June 16th.
It is. So the encouragement is hopefully we can get this out, by like Friday, because my goal is like I need nurses Saturday morning enjoying their coffee and just logging in and saying submit a comment. That's my goal with this. So.
Are you ready to shut this down? You ready to shut down this entire website because it's going to be so full of nurses?
That would be amazing if we could do that.
Nurses and social workers who are
nurses, social workers, healthcare, and I hate the word providers, clinicians, practitioners, like There are PAs, nurse practitioners that are dealing with this. Everybody has a viewpoint that needs to be commenting on this.
Yeah.
And Rose and I are going to help. We'll break down and share kind of like some of the key components. But there was an awesome nurse that actually made an Excel sheet. So there's technically 177 questions in this RFI.
If I go to ChatGPT,
Yeah.
I'm going to the ChatGPT screen. So let's use ChatGPT as a thought partner, not to say anything that I wouldn't say, but for the purpose of helping me formulate my thoughts into something that's coherent
Okay.
for somebody
Let's
who
do
doesn't
it.
read my mind. Okay.
And if you want to speak it, feel free to speak if you don't want to type it.
Yeah, well, I'm going to type it, I guess. Explain FMLA in one paragraph. The Family Medical Leave Act. Okay. In my experience as a nurse, I have seen both patients and caregivers lose or risk losing their job due to health issues requiring hospitalization and or multiple appointments. I know you wanted me to talk. I'm sorry. I'm just
No, you're fine. You're actually a very fast typer. I would be.
Oh, I did take a class in my homeschooling. I had a
I love it.
CD-ROM instructor.
Typing class in high school. Oh man, we're dating ourselves. I remember it was Sister Gertrude because I went to a Catholic school and Sister
my
Gertrude
gosh.
taught us how to type.
She was uptown, I bet. All right, let's see. For multiple appointments, the filing of FMLA varies by employer. The provider needed to sign it is often contested. I submit that a streamlined form that is not employer specific and can be approved by a physician or other provider with the click of a button in an EHR and then printed and handed to the person who needs it.
What do you think is the biggest barrier? Is it the physician? Because I see this so much. This is the same pain point of assisted livings. They all have these like an assisted living has to have a doctor say, yes, this person qualifies for assisted living. So same issue is that all of these assisted livings have their own unique form. They submit it to the doctor. The doctor often has to answer things that they're not even seeing because they're the primary care, so they don't know what the ADL issue is and all this stuff. Is that the issue where the doctor?
Yeah, and in our case, we have inpatient physicians and outpatient physicians, and a lot of the time, by the time people get their form from their employer, they have to get the form from their employer. They can't get we don't have it in the hospital. It's not in the EHR where we can give it to them at discharge, which if it's streamlined and it's set form and it's not going to vary by employer, and then yes, they argue about who's going to sign it because they go to their primary care provider if they have one by some miracle. But a lot of the time they'll come back and ask the hospitalist or the specialist to sign off
and
on
the ER doctor. I know Chris gets these
yes, they
all
had
the time.
a stroke, right, confirming this diagnosis that the primary care physician is not aware of. Or my favorite, when the specialist is like, no, we don't do anything outpatient, that needs to be handled by outpatient, and they don't have a primary care provider, and their follow-up with their specialist isn't for 6 weeks, and they're going to be long unemployed by then. The time delay and the time sensitivity is such a crucial part of this conversation, and I've spent so many hours of the last 5 years just trying to get anybody to sign these forms. And amongst people who want to help but feel like they're not authorized to. So
because if you fix it as a nurse, like you're trying to then call and get the form.
Mm-hmm.
I mean, if you're going to take on this legwork of the patient, but then and the thing I want to point out to anyone listening to this is anytime you make a nurse do that, that means that she's off of the floor not providing the care that she needs to be doing and using her brain and her skills in her nurse license, because we don't have a system that's making data flow. Got it.
Yeah. But also I have the assertiveness, right? Whereas somebody who is the front desk person or the or the scheduler or, whoever these, more entry-level health employees are there. They want to help as well, but they're not going to walk up to a doctor and tell them what to do.
Yeah.
Now, as an ICU nurse, if I have the assurance that I know this is what the patient needs, I know how to advocate for them and be assertive with a provider respectfully and say, no, this needs to happen today. Whereas someone who doesn't have that experience may not do that, and it just doesn't happen. It doesn't get filled out by anybody. They lose their job and then they want to go on unemployment. And I'm sorry, we hear how much this administration doesn't want that to happen. Well, this is a way you can keep that from unnecessarily happening.
I heart you right now. And that's what, okay, so I'm dreaming big.
I heart you every day, but okay.
I know, well, because I dream big. And I know the problem of standardizing a form for an entire state or even United States is a really hard task in the amount of employers. So that's where, when I'm dreaming big, when I think about, because my dream is I want a primary record in every family's hand. And if we get the health data to the family and the caregiver, thinking about how they are, if you can connect your employer and the form goes there, so then you as the nurse that's helping that family could hit a button for them, because that's where we've standardized this, and then basically print out for the doctor's signature. Like thinking about that, like and shortcutting some of the time. Anyway, that's where I dream big. Like how do you, because so much too is the person that has to fill out the form sometimes does not have insight to the whole longitudinal journey.
Okay.
All right. So look at Rosa using ChatGPT to come up with her comment.
Yeah. So I said, the instruction that I typed out was, if you're not looking at this, timely submission of this form would prevent unnecessary unemployment. And I told ChatGPT, write a 1-paragraph explanation of this. Timely submission of FMLA paperwork is critical in preventing unnecessary unemployment, especially for patients and caregivers facing serious health challenges. When delays occur, often due to confusion over employer-specific forms, uncertainty about which provider should complete the documentation, or administrative hurdles within healthcare systems, individuals may exhaust their paid leave or be penalized for absences, ultimately risking job loss. A streamlined, standardized FMLA form that can be quickly completed and signed within the electronic health record would reduce these delays, ensuring that those eligible for job-protected leave can access it promptly. By simplifying the process, we can safeguard employment during vulnerable times and support both health and economic stability.
That's perfect. Copy.
Do I need a story with that?
I mean, because that definitely was ChatGPT generated, right? So then it's like, and it was informed by lots of stories, right? Because you didn't experience this one time with a family or a patient. So there is some of this where it's like, yes, I think it helps structure, but you do want to make sure whoever's reading this comment feels what you feel on how many families have faced this, right? So I feel like it's just a tweak somewhere. So let's look.
Well, I don't know. Is it going to be read by AI?
I don't know. Well, from what I've read, my one friend
will.
I don't know. I do know, and some of the friends that I have in federal government, the intern's job was to go through all of the public comments and sort them and read them over. So, but I don't know what this administration is. It going to be read by AI?
Hold on. We need to talk to that friend and say, okay, what caught your eye as you're looking through this? If you're speed reading comments, what catches your eye so that you will read the comment? Is it all caps? Like, is it like variation in font where you say like one sentence is in all caps and so you read that sentence and you're like, do I want to read the rest of this paragraph?
No, I think, what I think is missing is an opening statement of who you are, Rosa. So in my little email I sent you, I am a stroke care coordinator with over and this is where nurses, even if you're a brand new spanking nurse, just use that or that social worker, because I think opening with, I am who you are, because if you think about it, when someone's reading, you want them to visualize this problem just like you're visualizing it. So put yourself in it.
I see. Otherwise,
doing live commenting. I love that you're just rolling with this.
Hey, girl. We're going to solve this. Federal Register. I'm going back there. Okay.
There we go.
So, as a nurse caring for stroke patients for over a decade, I see otherwise independent people who were working and providing for their family come in with a new disabling brain injury. Often that can be improved with physical therapy, etc., but that requires
so much time off work. Holy cow.
So much time off work, either to be in a hospital setting or for follow-up appointments. Patient and their caregiver, who may have been working as well, then need FMLA paperwork filled out so they can keep their income going during this time of upheaval. Is that too big of a word, upheaval? I don't know. Now I'm gonna copy my ChatGPT generated comment below that. Timely submission of FMLA paperwork is critical in preventing unnecessary unemployment, especially for I can delete that part because I just said that. Preventing unemployment. When delays occur, often due to confusion over employer-specific forms, uncertainty about which provider should complete the documentation, blah, 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 and then space it down here. There you go. How about that? Because I started...
That is amazing. And that's what I was Googling too, or not Googling, I ChatGPT, like what goes into FMLA paperwork? And I can see the hurdles because it's like, even whoever's filling it out has to be able to describe the serious health condition. So like it does, it's like, I can't imagine the nuances of getting the form to the right person and then that person having the right information to feel like they're not lying on a government form, right? That's got to be intimidating for a provider too.
Well, I think this is where I would insert it. Often an independent person who is working may not have a primary care GP or general practitioner provider, because a lot of people call it that too, right? General provider. Once leaving the hospital, the primary care may not have access to the hospital records to fill out the form accurately, and hospital staff. What are you thinking?
No, I'm getting ready for you because we're going to make sure we tag the comment section. So I'm like, sorry. And my dog's scratching behind me, so I'm like so distracted.
That sounded like a dog. I was hoping that was a dog.
He's digging into the carpet. He's not a smart animal.
Actually, he is, because your whole house is his property, and he's making sure his scent is embedded in your floor.
Yeah, he is embedding it right now. It's so distracting.
So hard.
Okay, sorry. Keep going.
Let's see. And hospital staff may not be able to provide it after discharge without requesting from medical records, which can cause additional delay. A streamlined, standardized FMLA form that can be quickly completed and signed within the electronic health record. I'm gonna put capitals in case there's a human reading this. Okay. Caps lock, come on. Timely. Yeah. Submission of FMLA paperwork is critical in preventing unnecessary I can't believe that I'm about to put this video on the internet of my
I love you. I love it so much. All right.
I'm going to be
Let's
embarrassed now.
No, you're not. You should not be embarrassed. This is so powerful, either to be in a hospital or to follow up. Okay. I'm trying to think of the place on is what you're informing. I have two that I would love because we want to tell the folks reading this that you're informing parts of the RFI.
Is this the part where it's like, what is your comment about? Is that what you're thinking?
Oh, yeah. So say PR-3A. This is about administrative burden.
Down here?
I would say, what is your comment about? Here. Oh, yeah. Click the drop-down menu. Does it make you select?
I'm in the drop-down menu. Can you not see it?
I can't see it. So what are you seeing? Can you describe it?
A lot of things.
Uh-oh. So I don't know what that one does.
What did you say I need to look for?
This was prompted by what features are missing in today's digital health tools for patients or caregivers. Is that what prompted this? But the other one would be PR3.
It's not going to look PR3.
Which I think is like the provider section. 3. How important is it for healthcare delivery and operability in urban and rural areas that all data be accessible? Come on, ChatGPT, you just totally failed me.
Okay, there's academic, ambulatory surgical center, association, attorney law firm, chiropractor.
What? Okay, I need to get on this
employer, yeah, you need to get on here. Government, federal, but there's also federal government. What? I'm sorry, what's the difference between federal government and government #federal? Like, I don't know. And there's government state. And then healthcare industry, nurse, but there's another thing that says nurse. And this is not nurse specific. There's one that says social worker. Is there one that says anything about unemployment?
Here, I'm looking too with you. So
there's health plan or association, individual.
Organ procurement.
I see that too. You're looking at
I know, I was like, okay.
Physical therapist,
let me tell you,
rural health clinic, social work. See, there's another social worker. I don't know which one this is that I need.
Yeah, this is really...
I think it's federal.
Oh,
But I don't know if it's federal government or government federal.
What is your comment about? And what does... All right, well, I will find... Here, let me just ask.
I'm going to select for now federal government so I can look at other things. And so I'm going to copy my comment and save it in case I need to go back and resubmit it later under a different category. I'm going to save this.
That's really... comment? It's really weird to me because it's saying in the ChatGPT that we should be seeing, like, what section.
Well, maybe we will also see that. What is your, let's see, email. I don't see anything else about a section. There's...
Maybe it's a bug in their system.
I don't know.
Yeah, I think you're good. Just comment that. But what I was thinking was that we could put at the top or the bottom, my comments are related to PC-4.
And I'll just do info@nurserosaspeaks.com.
Perfect.
I'm an individual.
Okay. And I won't make you do all this. You don't have to put your address on the internet.
I mean, remember back in the day when we had the phone book?
I know. It's a good point.
People are like, there's no privacy anymore. I'm like, I mean, how private was your information before? Really? Your information landed on literally everybody's doorstep. Literally everybody.
All you needed was the last name. Yep. I think you've done a bang-up job.
Well, I want to show you. This is what happened next. Since you haven't gotten to this, you get a comment tracking number. I'm going to save that, I guess. I don't know. I guess I'm going to save that.
Print your comments on your records. Okay. So you can keep track of your record or whatnot. But there is a public site. So just some caveats, like, don't bash people, like, don't bash your employer as a nurse, like, because when you comment, it's a public comment. So, like, just tactic, your views also aren't representing your employer, right? This is another big problem nurses face all the time is they're scared to speak up because then their employer might come after them for commenting on a process that they don't want out in the public, right? So if I was a nurse with some information that made my employer, anyway, you just want to think about, like, it's not your employer's fault. Like, I want you to think bigger. Like, we need better policies, we need better infrastructure so that these just get better. So, so the whole point of all that was things are public. So just be smart about what you're putting. You don't want to put in your personal health information, or whatnot, or share another patient's really personal identifying story. Nurses are usually good at this, but let's just speak it out loud. Just to
usually. Usually. There are exceptions.
I love
to
our
every
nursing
rule, right?
profession. We are a spectrum of all kinds of personalities.
Good Lord. Okay. Well, I
But I
think,
don't care who you are. Comment.
yeah. And
All right.
wherever we're posting this video, we'll have a link to the regulations page so you can make a comment publicly. And guess what? You're better qualified than anybody who's not you.
It's true. And I will make sure, Rosa, I will kind of go through and highlight some of the key ones that I think if we prompt, because like it was awesome. I dragged you through it was, which was great. You know, you heard that question and it led to, God, FMLA, if I could just fix this for my patients, like that's the kind of, those are the things I want nurses commenting. Like, yes, we all kind of will be like, oh, we know we should be commenting on this because med affordability is an issue, but I want you to comment on the things that you're like, why doesn't anyone solve this?
Right. And I mean, when you're thinking of who's your audience, right? This administration wants to prioritize keeping people at work.
That's a really good point.
Layers of the pricing of things, like we could ask the government to maybe cap prices, like if something's being sold in Europe for $30 and $3,000 here, could we address that legally? Maybe that is a thing you could suggest if you know specifics.
No, that's a really good point. Thinking about what this administration, like I listened to the hour webinar, and it's a different world. Like it was fun just when they're like, all right, now Dr. Oz is going to speak. And I'm like, okay, like it's just different. It's different, but it's great to listen because what I heard is they want us to dream big. They want to deregulate. They want competition. They want a better experience for our patients and caregivers. And we all know that patients and caregivers often don't have the time to comment on things like this. So who's the next best person? The team of people around them that's trying to help them. And those are, like you said, social workers, nurses, physical therapists, occupational therapists. Like if you have had the thought in your day-to-day, God, why doesn't anyone fix this? This is the RFI to comment on.
And maybe somebody is, hey, if you're out there and you already think you have the solution to the whole FMLA paperwork conundrum, please tell me so I can sleep better tonight. I would just like to know, and I will support you.
You got champion. She will be the best salesperson ever. Let me tell you, Rosa Hart will go to any conference you want.
You have buy-in.
All right, my dear. I really appreciate your time doing this.
Hang on just a minute. Thank you, everybody, for listening. Please follow Jean Ross and Rosa Hart on LinkedIn and social media. I'm at Nurse Rosa Speaks, and she is at Primary Record, right? And follow the Nurse Rosa's Insights podcast. This is a special
It's who I first thought of when I needed to get this blasted out.
That's right. All right. Bye.